despite I was young then, but I walked a nurse out from my room. I walked the nurse out from my room. I told him that if you don't leave my room, I'm calling the doctor on you, and I'll make sure you fail. She left. How can you have an issue with your boyfriend over the night and you are claiming me up in the morning and you're on the phone? No, you don't do that.
Jose, I know you can't remember, but what have you been told about your hospital experience? What worked, what did not work, what would you like see improved? Even now, Jose, as you're a grown-up, are there any gaps you normally see in healthcare service delivery in our hospitals? And what are the good things you also see? We can share so that we can borrow what's good and see whether we share common problems. I can start with you, Obum. Obum, yeah, I can start with you.
Okay, good day everyone. I hope you guys can hear me, right?
I can hear you. Yeah, we
Yeah,
can hear
see,
you.
I can remember my hospital experience from the first day I stepped into the hospital to today. you know, you
Yeah.
know, my hospital experience was not a good one because I was sent to um, a teaching. It's a missionary hospital with a form of a teaching hospital as well, whereby the students use you to do some certain analogies and some certain trainings, which I don't want it to happen to any other person, because when there are some cases that you can teach somebody without letting the person handle the victim, knowing fully well that the victim is not a cadaver that you use to do experiments, right? Okay. Now, there's this thing I'm talking about happened over 20 years ago, maybe 21, maybe 22 years ago. Young learning nurses coming into the theater into the dressing room to use forceps and then gauze to clean me up when you are not properly trained on how do that. That's a easy thing to do, because in the process of trying to clean the wounds, because you are not properly trained, you might use the forceps to tear more damage on the wound surfaces or on the burn sites, right? Okay, and then one more thing majorly about this treatment of burn survivors or burn victims is, I think nurses or healthcare or even doctors that treat burn survivors or whatever serious cases should be mentally and emotionally be prepared, because for instance, you can't be having an issue with your husband or maybe your wife in the house, and you're not psychologically stable to come to work, and then you transfer whatever garbage you have on top of your patient. That's not fair. Despite I was young then, but I walked a nurse out from my room. I walked the nurse out from my room. I told him that if you don't leave my room, I'm calling the doctor on you, and I'll make sure you fail. She left. How can you have an issue with your boyfriend over the night and you are claiming me up in the morning and you're on the phone? No, you don't do that. Yes, the main reason why everybody go to the hospital is to get healed and go. Yeah, but both of the people that go there, instead of to get healed, they die because of what the nurses might have told them. Even some nurses, when they come into the hospital, and maybe the doctor have assured me in the morning, like, "Oh, Obum, you're doing well, you're responding to treatment," even if he's lying, I need that motivational prep, right? And the nurse will come into the afternoon duty and say, "Hey, what the hell? This is so gross. What have you been giving him since?" And you're saying it to my hearing, as in, oh, it's a biased thinking, right? And but do you know, I really don't. Let me say, it was because of my age that made me to survive that. Like, I always tell people, oh, my data is running low. Okay, I said if it happened to me today, I wouldn't have survived it. You know why? Because I don't think I still have that strength or that emotion to carry on a third degree burn with over, let me say, 65 or maybe 75%. If you Google third degree burn with 75%, you know what it means. You're just lying there for people to use you to do illustrations till you pass out and they bury you. But I survived it. So the health sector, it's really bad because when the process of the burns is healing, it comes with a very strong itching, and you need to stay in a well ventilated room or ICU in the hospital where the fan, it's like blowing every time, even if you don't have money to get an air conditioner. But a burn survivor or a burn victim needs to stay in a well ventilated room, because when the scratches comes, it doesn't go. I don't know if you see someone that is a burn victim. No matter how old the person comes, there is still that tendency of the person scratching the burn site. It happens no matter how hard you try to manage it. The scratches or the itches, it happens. And so I think that I remembered so much. Okay, I've talked about the dressing of the nurses, the doctors, and then all the surgeries I've been through. And it's expensive, like my brother said in the course of the discussion. It was done on us financially, and the government does not provide or does not put any plan in place to to help people pay their financial bills. And the hospitals are not even taking, and the hospitals are even making it more difficult for us. They won't give you insurance bill, health bill, or whatever. Everything they do is just on the news, 9 o'clock news, 20:00 o'clock news. They don't do it on a day-to-day activity. So it strikes on the bills. And then what about the fake drugs they administer to people in the hospital? A lot of fake drugs are there, a lot of fake injections. Okay, because I know when they were treating me with gauze and saline water and then damazine cream. They use every morning when they want to clean me up. They use gauze. Yeah, they use a cotton, will roll it in the forceps, and then use this saline water. It's like a drip. That's where they soak the cotton wool inside and then use it to be cleaning the sides, the bone side. Then when they remove, they put something like a mask. It's a four-way antibiotic. After cleaning the surface, they use the forceps and they put it on the bone sides. Then the next day, the body will have assimilated the antibiotics that is in the net. So they use something like a saline to soak it. After soaking it, then they use forceps to bring it out. Some nurses will not even soak the gauze very well. They will just use forceps and drag it out. And when they are dragging it out, you are in pain, it's bleeding. The healing that might happen overnight will start all over again. I think you need to understand it's like it's like going to hell and walking out back. And then after that, in more of your questions, I'm going to answer about the traumas you go through in the hospital and then the traumas you go through after the hospital. So this is the few. I don't want to waste much of our time, but truly I've mentioned about the finances that it takes in the hospital. I've mentioned about the government not giving adequate medical health care. I've talked about the psychological and the mental stability of the people or of your caregivers, right? Let's use caregivers because it suits both doctors and nurses and maybe the matron or whatever. And then I've talked about the lies they put up on the TV, how they help people in the hospital. All those are lies. So I've mentioned 4 points here. So in the due course, I'll still go more to talk about it. Thank you.
Might you know about medical cover and whether it helps when it comes to burn victims in Nigeria?
It was my father that paid all the bills from A to Z. And he said it before in his introduction that our finances was hit so much that it was a very good, like, even if I wake up today and my father said, I'm not giving you a land today, I have eaten all our land money. So the finances, there is no bill in Nigeria that covers, but individuals can go online. Let's say from maybe 2015, because of the introduction or the inception of the internet, some individuals will go online, maybe take money from people, maybe do one or two adverts that they want to care for people, and then they scam the people. So even online people now in Nigeria, they don't even want to help. But talking about the government has, and I quote, take me to anywhere that there is no medical bill that is going to, even malaria, we hear it on the news. Talk less of bonds that requires adequate surgeons and adequate money.
So my own memory of hospital was when I had a surgery on my right leg. They were fixing the vein because right by my knee, I couldn't bend my leg, right? So therefore, I was walking quite funny. And then Professor Scholz, my surgical doctor, then had to cut the vein. So it was a really hectic, surgery. So anyway, to cut the long story short, I was around 9 years old, I think, and I was told to put my legs like this on the bed, right? I mean, you're saying this to a 9-year-old, like, really. So lo and behold, I was running around in hospital with that operation. and like nurses would just like come running after me, Itumeleng, and I was like, ooh, catch me if you can. It was so funny. And then this one time I ran into the lift, and and you see these nurses just like running after you. It was hilarious. And then I pressed the lift to go down, and yeah, needless to say that by the time they caught me, they strapped me on that bed. It was so funny. Yeah, so so that is one of my fondest memories, really, of hospital. So I was blessed enough that my mom, immediately after I got burnt, she got a medical aid with bonitas, and they were absolutely amazing. I can tell you now that they made sure that every single surgery that I needed, that they provided for. So we had no financial, headaches. Basically, the only thing that my mom needed to worry about was me. Like I said, my mom got a medical aid, so therefore it was a huge blessing, really, that I was moved to the private sector. So I was then moved to a private hospital, private care, which was absolutely amazing. Absolutely amazing. I cannot complain, at all. Private care in South Africa is very, very good. Okay, so my mother was a big part of my recovery and support system. She's been there from day one. She was there to, hug me, kiss me, cuddle me from the get-go. Another thing as well that my mom blessed me with was to take me to a boarding school, but it was a physically challenged school. It was for those who were like physically, challenged. So we had physiotherapists, occupational therapists, speech therapists. We had doctors on site, like, darling. We had nurses. We had any single profession that you can think of in the healthcare system we had. And therefore they helped me to be the person that I am today. They helped me to write, to speak well, to do this, to do that. So today, because of physiotherapist, I can now bath myself, clean, clothe myself, feed myself. I can do everything, darling. Yes. So that's the great support system that I had. So that was amazing. Like, we had everything from psychologists to social workers. If the teachers thought that you were going through something, immediately they would ship you to like a psychologist, like a social worker, or like whatever. So we had such a huge support system.
As Obum was talking, I'm like, oh my gosh, we have so much similarity, with the hospital setup and everything else. But of late, it's been a slight improvement. There's some improvement now with what our predecessor, Mr. Joseph Gidoro, efforts were doing even before I became a firefighter. And right now you find that the hospital management, like now in the burns unit at Kenyatta National Hospital, working in line with the fire advocate on the ground in the community level. So there's a bottom-up communication. So right now with the introduction of National Hospital Insurance Fund, NHIF, if you're a member of that, you get to see that you benefit from the medical cover. However, not all 100%, no. It's just a small portion of the big bill that you have. Yeah. So in terms of medication, you might find that the doctors are going to tell you, hey, these are the medications that are needed, and they're not available in the hospital. So you find whatever, for example, like Mr. Obum's parent had to go and buy this medication, So you find also that happens here, But in regards to what we call it, surgeries and everything else, it's not 100% taken care by the government, but you find that some small percentage is taken care of with the government or by the government. But most cases, you find the families really getting so dented with the hospital care. Because for me, I do the visitations after the burns, and you find that the patients still in the hospital are really saying, hey, we don't have money, and we have to really dig down our pockets and things like that. And truth be told, in the informal sector, who is on NHIF, or who will even think of enrolling themselves on NHIF? Will they think of the plate of that night, or will they think of the monthly contribution?
Yes, yeah.
And for me, that is actually what I advocate for when I'm in the seat as a fire safety advocate. I tell the doctors, and I really thank God, Dr. Shaban is here. we really push for them to actually make policy in such a way that they can get the government to push for more funding in the burns unit.
Is burn survivors, is treatment ongoing? Have you like ever, or did it stop for you?
In my case, because I'm growing, and it's interesting that I stopped growing in terms of my body, but I'm growing. You find, I wish I could have shown you, maybe I can. Let me open my, so here, I got this, I couldn't be able to stretch. It was like this. But then I went for surgery and then I could stretch straight. That was a miracle. But as I went growing older, you can see that there's this flesh coming out. So this needs to be gotten rid of. And also, if you look at my face, I'm not so sure if you can see, there's this fold. This fold here, it has always grown with time. So, and it's, as just Obum talked about, it's not going to be free. Yeah. I also went through another surgery about 10 years ago. That there was a growth here. I had to go remove it. Just a small thing. It costed me like $600. Yeah. So again, now this fold, I'm being told, is going to cost me about $2,500. This here is going to cost me up to about maybe another $3,000. You know, it's really costly, you know. So you can imagine, just like what Obum says, and I concur with him, that, you know, if you go ask your parents for your inheritance, they say, dude, you already finished your inheritance.
Yeah.
You know, so
it's ongoing.
Right now, it's continuous, and yes, it's not stopped. It's ongoing.
Okay, actually, I don't have any ongoing treatment anymore. The last treatment I had is like over 15 years ago.
Okay.
So there's something Josiah pointed out about his face, right? So, you know, there's something about bonds. If you have, like me, when I tried to do some skin grafting, right? So when I went there, the surgeon sent me to a skin therapist or a dermatologist. I don't even know the right words. So when he sent me there, I had to go for a skin test. When I got there, they told me that my skin is keloidal. So even if they scrape this whole thing now, today, in few weeks' time, it will come out. And this time when it comes out, it will be bigger than this. So it's like this skin is like it's genetically engineered, like this is my gene. Yeah. So when he told me, when like, okay, my hand was like this, I had to be like this, stitch it all the way from here to here. You know, I was small, so when it was healing, I went for about 6 surgeries, right? But it was when I was small. So when I was growing up, I was forcing it to stretch, and then there's also one victim are supposed to wear some compression mask, right? But then there wasn't compression mask, there wasn't all these bone treatment, you know, and all those. It wasn't as of there then. So I just managed it with the little we know. Like my younger brother said before, where nobody was trying to prepare for being a fire victim, right? So it's I don't have any treatment. The only treatment I'm going through now, it's anxiety, depression, and then trying to get a job, because getting a job is bad. It's bad because you don't look present. You don't look good, you know. So getting a job and all that. So that's the only treatment I have. So talking about my bonds or whatever, my darling, I've accepted myself the way I am, and I've moved on.
Okay.
Yeah.